Welcome back, everybody. My name is Johannes, and I'm a fourth-year undergraduate student studying biochemistry. And the autoimmune disease we'll be breaking down today is rheumatoid arthritis. Real quick, this channel aims to discuss autoimmune diseases in an easy-to-understand manner. It could quite literally take a couple of weeks to discuss one of these autoimmune diseases in its entirety, but hopefully we can condense them in a rather simplistic way for us to get. All right, let's get it started. Alright, so rheumatoid arthritis is a chronic disease marked by symptoms of inflammation and pain in the joints. When a person has rheumatoid arthritis, their immune system attacks the lining of their joints in their hands, feet, wrist, knees, basically every joint in the body, and can even affect internal organs such as the lungs, heart, and eyes if left untreated. For people with rheumatoid arthritis, they can have a myriad of symptoms that trouble them along their day. Pain or aching in more than one joint, stiffness in more than one joint, tenderness and swelling in more than one joint, the same joint symptoms on both sides of the body, and loss of joint function are all symptoms that are typical with people who have rheumatoid arthritis. So when discussing these symptoms, it's important that we have some language to describe these different types of symptoms and when they occur. During times when these symptoms are active and present, these are known as flares or exacerbations. Conversely, oftentimes when symptoms are not active, this is known as periods of remission, and these are periods where the symptoms completely disappear. Now, when most people hear arthritis, their mind typically thinks of the most common form, known as osteoarthritis. The differences between the two arthritises is that osteoarthritis is the natural wear and tear of the joint and its lubricant as we progress into old age. While rheumatoid arthritis, as stated before, is the autoimmune system attacking the synovium, which is known as the lining of the joint, causing inflammation amongst other symptoms. See, what's interesting about rheumatoid arthritis is that when a person has rheumatoid arthritis, they will oftentimes have inflammation or pain in one joint that matches the exact same on the opposite side of the body, right? So if I have one in my left pinky, more often than not, my right pinky is going to have the exact same pain, while other joints might not be affected. And this is one of the ways doctors are able to diagnose rheumatoid versus osteoarthritis and help give people the correct diagnosis. In osteoarthritis, however, because it's due to the natural wear and tear of the joint throughout as we progress in age, it could be, in one knee and not the other, in one elbow and not the other, and so it's just a way to decipher between the two. So now we're going to discuss and talk about certain risk factors that increases your chances of developing rheumatoid arthritis. Remember, rheumatoid arthritis is an autoimmune disease, so there is an element of developing it because it was just in your genes or your deck of cards, but these factors that I'm going to list here will increase your likelihood. So the onset of rheumatoid arthritis increases in adults among ages 50 and up, and women are also 2 to 3 times more likely to be assigned rheumatoid arthritis than men for some reason. Children whose mothers smoked have doubled the risk of developing rheumatoid arthritis as adults, and obviously obesity and diet play a huge factor in everything in your life, but it is one of the factors that affect your chances of developing rheumatoid arthritis. So now we're going to discuss what rheumatoid arthritis may look and feel like, and it can present different in different people. Swelling of the fingers, wrists, knees, ankles, and toes are all very common, basically any joint you have in your body. As well as damage to the ligaments in your body as well that can cause it up to swell as well. So a person with rheumatoid arthritis might have trouble walking and may need, a walker or a wheelchair to assist them in that. Deformities of the hands and fingers may also look curved, creating almost like a claw-like shaped appearance, and that is one of the most common symptoms of the disease. So, I just got diagnosed with rheumatoid arthritis. What do I do now? What are my options? And unfortunately, there is no known cure for rheumatoid arthritis, like many of the autoimmune diseases we've discussed here on this channel. But there are remedies that can help you mitigate the pain tremendously tenfold if you stick to them. Treatments may include medication, alternative or home remedies, dietary changes, and specific types of exercises to help loosen and help those joints grow stronger. And there you have it. That is the breakdown of rheumatoid arthritis. Obviously, nothing in this video here should be taken as medical advice or what have you, and you should consult a physician or a licensed medical provider for any questions you have regarding rheumatoid arthritis. And as always, thank you so much for watching this video, and take care.